Hi everyone, this is Patricia from the International Hospital Federation. I hope you're all safe and well, and thank you very much for joining us today. Managing COVID-19 has been extremely challenging for hospitals and health systems around the globe. We're hosting this webinar and live Q&A series to share experiences, good practices, insights, and recommendations from our members and other organizations. The series has been created with healthcare providers for healthcare providers, including decision makers and those involved in preparing for and managing COVID-19. I would now like to introduce the moderator of this webinar, IHF CEO, Eric de Rudenbeck. Eric?
Good morning, good afternoon. Thank you, Patricia, for the introduction. Welcome everyone to this webinar. Today, it will not be about the experience of hospitals in one country, but we'll have a chance to go over an issue that we all face in all parts of the world, traceability. If with COVID, this concept has become a priority to limit the spread of epidemics by clustering contact people with an identified case, the need to manage flows to identify precisely how people and goods move around is not new in hospitals, as we have been used the sense of traceability, especially for sensitive products like drugs and implantable devices. However, the COVID crisis has demonstrated that this is not enough. We really need to have in place a full system to better trace people, goods, and places, because safety of staff and patients can be enhanced when such systems are really fully in place. So let me introduce you our speakers today from GS1, a non-for-profit global organization in charge of standardization that is part of the IHF network of members. The speaker will be Dr. Els van der Wilden. She's the Director of Healthcare Providers at GS1. Dr. van der Linden, just say health, it's easier, is a medical doctor working and director of healthcare provider GS1. She has a degree in public health. She has experience in healthcare governance and patient safety, worked in cross-cultural medical work, especially experience in Africa. At the payer side, which is quite interesting, the side of the insurer, the one that are paying us for the work we are doing with the patients, but also in hospital management. She has been in charge of academic hospital, medical board of a teaching hospital. Now that she's in charge of GS1, her responsibility is to support the global work with hospitals and drive the engagement of hospitals to better understand and address the needs and opportunity on the use of GS1 standard and traceability from a broader perspective, from the supply chain to the clinical work. Els, the floor is yours, and we really look forward to hear you.
Thank you very much, Eric. And indeed, sometimes it's more easy to talk about, first names than about family names. Thank you very much also to IHF for offering GS1 the opportunity to share something that is really passionate in our work. For me as a medical doctor, as Eric explained, it is not always easy, especially in this time of pandemic. It has been very difficult not to be at the forefront and support the frontline staff, but to be a little bit more in the background, support a lot of other work that will help the people in the frontline to be as most effective as they could be. I made a very brief agenda for today, and I would like to share with you on how did the COVID crisis actually accelerate process rethinking that already was in place? How can the healthcare supply chain support that rethinking? And how do global standards in the healthcare supply chain bring big benefits? And I will explain a little bit about GS1, the organization and the system of standards, because most of you will not even know the name GS1, but many of you are familiar with the system without even being aware. And I'll share some of example and share a patient pathway with you. As you might understand, we do have a lot of materials at GS1 because we are a not-for-profit organization with a lot of members and we share the good examples. But since everybody is very busy with the COVID direct work, we do not yet have a lot of written materials that I can share with you on the COVID experiences, but I'll be more than happy to share with you whatever we can. The global pandemic urges all of us to rethink. If I just look at what the pandemic has done directly in healthcare, it disrupts lives, it brings a lot of suffering, and so many people are dying and suffering. It's really, that's distressing, the really distressing part. Another distressing part, what we see is that healthcare workers spend overtime to take care of terribly ill people, and sometimes the burden is too high on the healthcare workers. Also, we see that healthcare systems are stretched to their limits and even beyond their limits. And one of the things in the modern world where we have a lot of sharing is that on news, on social media, we are faced directly with these sufferings and burdens. But it also helps us to understand the urgency and priorities. What the pandemic also does, and that is what Erik already briefly touched on, it shows the importance of a safe healthcare supply chain and of the necessity of good product identification. And why is that? That is because it supports safe patient care. If supplies are not safe and are not in the right time at the right place, patient care is suffering. At the pandemic, it has a very specific extra, and that is we need the PPEs to protect our healthcare workers. I read the other day the number of people, healthcare workers that all have passed away in the UK. Just one country to mention because they were very open on sharing the number, and you know it makes you very sad. Frontline workers that get sick and die when they are treating very, very ill patients. So for me, that is urging us that we really need to make sure that these healthcare workers get safe and enough supplies to be protected well. And we know that even then it doesn't prevent them from getting ill, but we need to support them as much as possible. Another thing that's important on a safe healthcare supply chain is that you need to know where are your products coming from. What is your supplier? What is the country? What is the quality? You need to know once the products are in your hospital, where are they? Are they in the storeroom? Are they on a department? Are they on a shelf? Where are they? And you need to know for whom are they designated. And a last bit is if you have a safe healthcare supply chain, that is a major, major asset to fight substandard supplies. And when you fight substandard supplies, it helps also save money for healthcare. And these are some of the highlights I want to talk with you about during this brief session. This slide is something that's not specifically linked to the COVID because this is material that we can, are statements that we can always use. Medication errors result in additional treatments, in disabilities, and sometimes in loss of life. And we know that healthcare workers, give their utmost to make patients well and to give proper treatment, but medication errors can also can always occur. If you use the barcode identifier on the product and the barcode scanning up to the patient, to the point of care, that helps reduce the number of medication errors drastically. Also, when you do the barcode scanning on the materials, medications, medical devices, it prevents manual registration, and manual registration always is a risk for errors, and it reduces efficiency and accuracy. When you use the barcode scanning, the traceability from manufacturer to patient will be much better. If you do not have a safe supply chain, you might not be able to trace back devices, instruments, medication. And we just need to think back of what happened with breast implants, hip implants, and some others, where it took a lot of time and effort to do the recalls, and sometimes hospitals were not really could not really do a recall on all of their patients. When you have used barcode scanning and your healthcare supply chain is safe up to your patient, it's much more easy to do a recall. And last bit that we saw during the COVID crisis, that there is a lack of safe PPEs in some countries and in some places, and that is really a very, very big threat to our staff and patients. I want to show very briefly an example, and as you will receive the slide deck afterwards, you can look into more detail when you see these slides. But Turkey started many, many years ago to build a centralized safe system for their pharmaceutical supply chain. And what they actually did is their reasons to start with this. The purpose was to enhance the ability to combat illicit drug sales and to combat barcode scams and theft. What they see as a result of many, many years of implementation is that there is a high number of annual savings, about 1 billion each year, which is really, really a lot of money that can be spent on healthcare in another way. What they see at present is that they have 45 million daily transactions of drugs in the supply chain designated going up to the patients. And what they see is that their recall management system is very sophisticated and efficient. They have built this track and trace system completely leveraging the GS1 standards. And if you want more information, just drop us an email afterwards and we can share more details with you. If I go back to the inside of a hospital, this is a picture taken at in an operating theater, and trust really begins with understanding and visibility. The staff that is operating on this patient at the moment, they need to know that the material that's being used, this is an implant, for instance, that the implant is safe. They need to understand, is this the one we ordered? They need to see if the type and the size are correct so that they can really use it on their patient. This product, as you can see, has barcodes on, and we'll go into a little bit more detail later on which barcodes can you use for what. The GS1 system is in fact system agnostic, and our barcodes, our identifiers, can be traced throughout all systems, and they are very interoperable. They can be used in several systems. If you look at the operating room, then this one, global location number, is a GS1 data matrix, which actually is on the door or on the shelf and will help put the supplies in the right location. The GS1 system can be used for oxygen, ventilators, for computers, for whatever, for the assets you have in a hospital. Here you see the syringe has also a barcode, and that is to make clear that this is a product. You have the doctor who is barcoded, instruments can be barcoded, and of course, to be on the very safe side and have your safe side in the hospital, your patients can be barcoded as well. And these are all based on a traceability standard in which all these products are clearly outlined. Now, what is GS1? In a nutshell, GS1 is not an acronym for anything, it's just GS1. And we are best known for the barcode. If you go to the supermarket or to any other retail shop, you will find a barcode on all of your products. Those are the same ones. So we are known for the barcodes. Originally, GS1 started some 45 years ago in retail to help the supply chain in retail. And 15 years ago, GS1 moved also into healthcare, and that's where we now see a lot of our work. Globally, GS1 works in 150 countries to be precise, and in 114 countries, GS1 has member organizations. So we're a global, not-for-profit member organization, and really spread all over the world. The GS1 global system of standards consists of three main components, which we call identify, so standards for identification, and I'll show you some more in detail on the next slide, but this is for location numbers. The GLN, like you see here, is for location numbers. We have an identifier for products, for assets, for here locations again, etc. And each of these is very specific. You can do nothing if you only identify. You also need to capture the identifiers, and to capture the identifiers we actually have the barcodes. And this is one that you see often on packages, on medical packages, and this one, the GS1 data matrix, is the one that is very, very common in healthcare. And then if you capture with your barcode scanner these identifiers, you need to share the information that you capture with your scanner can be shared either as master data containing a lot of the product data, it can be shared as transactional data, or it can be shared as event data. This is just our mantra, you know, identify, capture, and share. And it's all about the information that is being identified and shared. If I go into the product, and sorry, but I have to explain some of the techniques before we go to the examples. We have a global trade item number that we call a GTIN to be short, and the GTIN, if only an article number is needed, the GTIN can be in the EAN 13, very common in retail. When more information is needed, we use the GS1 128 because that one has a lot of more space to put the numbers in. And then you can see several numbers between brackets. The 01 is to identify the product. The 17 makes clear that this is the expiration date. The 10 is the batch number, and then we have 21, which is a serial number. More modern, so to say, and very useful for items with a small surface is the GS1 data matrix. And in the GS1 data matrix, you have exactly the same, the 01, so the product number, the expiry date, the lot, and the batch number, and if it is indicated, also the serial number. This one can be very, very small and be also lasered on instruments, for instance. Showing you what is very common now globally, we have the unique product identifiers with these 4 data attributes that I mentioned present. This is the data matrix containing all the information, and this is what we call the human readable information, and none of us has data matrix eyes, so whenever I see a product, a medical product, I also check what is the human readable information, is the expiry date correct, etc. Here you can see the line of a list of some of the very important items that are used in healthcare. As I said, the GTIN that identifies a product. So a product coming from a manufacturer will have a GTIN on. The GSRN is an identifier to identify the patient or the caregiver. You can see here in the wristband. We have a shipping code specific, and then you have the global location number again, and any assets in the COVID crisis, the ventilators, the respirators were very important. They will have a specific identifier as well. And what does GS1 do specifically? GS1 links, so to say, the dots of the healthcare supply chain. Our standards are global, used all over the globe. They are open standards. Nobody needs to, pay money for it. Our standards are not developed by GS1, just GS1, but since we are a member organization, we are the people using our standards are also the ones that are members of GS1, and we have a very, very tough system in which if there is any change in a standard, it will be discussed with all the people involved, and only when there is full agreement, any changes or additions will be made to the standards, and then these will be applicable globally again. And we do not have GLN specific for healthcare. GLN is a standard that's being used throughout the 25 sectors in which GS1 is working. And here you see the manufacturer will have his GLN. He'll make the products. These products will be packed. They will go to a logistics operator. And on the far end, you see these products will finally reach the patient. And they can be tracked in each step of this process using the standards. I want to share with you an example that is very applicable to this COVID time. Surgical gloves, I could have taken masks, gowns, but I thought let me stay to the surgical gloves. Surgical gloves are, as we call, a primary package. One pair of gloves. On the pair of gloves, you will have, as I shared with you before, these specifics on the identification of the product. If the gloves were only to have a product number, you could use this EAN code, but on these gloves we would like to see expiration date, serial number, lot number, because that adds to the safety of the product. So then this data matrix is the best identifier to use. Now, how does these gloves, this simple package of gloves, how do they travel? We say there is a product hierarchy. So you have the GTIN, the global trade item number, on this pair of gloves. The same GTIN is applicable on the secondary package with a small addition. So you can see it's the same GTIN, but there is an added number. I didn't add all these numbers here because that would complicate the picture too much. Same GTIN will be used to add all these secondary packages in a case with a number of boxes in, and you can use the cases. They can be compiled together to, as we call, a logistic unit, which then will have a specific number on a serial shipping container code. And if you scan this code, you will know the number of boxes, the number of secondary packages, and how many primary packages do you have. So when you are a hospital and you have ordered, you will receive a logistic unit, and your staff can then unpack the cases and distribute throughout the hospitals, scanning this, scanning the location where it's going to, and you will definitely know where your products are. If I go touch very briefly on some other thoughts. Here you see in the bottom of this slide, we call this the clinical patient pathway. I took out a few slides to show you as an example. On the bottom slide, you see the icons of the what we call supply chain. Regulatory authorities influence and steer very much the use of product identification in many countries. On the downside of this picture, you see the non-clinical, so the really supply chain side on the manufacturers, suppliers, etc. On the top of this picture, you see what we call the clinical side, where you have several steps. We really made it a bit simple. patient come to the outpatient clinic, admitted, being operated upon, medication or whatever is prescribed, they go to the ward to recover a bit, and once they can go home, they are discharged. The GS1 standards are here in the middle because it is a shared flow of products and data. If I look with you into the operating room, you can see a little bit of the responsibilities. You have inventory control, there is data and insights, very important post-market surveillance. Information can be fed back to the manufacturer. And so these are all linked, and all of these steps use the same GS1 standards and the same product identifier. Some of the benefits of this implementation is for both the clinical and the non-clinical. But as you can understand, investments need to be made. The manufacturer needs to make investments in order to be compliant with the regulation. Regulation forces or drives manufacturers to barcode their products with identifiers that have been agreed upon by the regulators. And they need, of course, to adjust their supply chain and their production lines. Hospitals, you really need to make an implementation cost for hardware, and you need to train your staff. Summarizing, for all of these steps in the clinical pathway, the GS1 standards can be used, and they link the non-clinical side to the clinical side and bring benefits to both. Summarizing that, traceability from manufacturer to patient is one of the great benefits from this, from the GS1 standard system. And regulators, for instance, we see the FDA in Europe, but also in China, many countries in Asia, many countries in Latin America and in the Middle East region. We see that regulators require global standards and the use of global standards. And these regulations will really drive the market, because if manufacturers do not have global standards on their products, they might not be accepted anymore in these specific markets. A side effect of that is that you see also, and that's what probably has been seen in the COVID time, healthcare is money-making business, so you also have people who want to make materials and earn money on it. And in the COVID time, they had a great opportunity to share these products on the market, and these were not safe products, and they would not have the global standards on. So it's really something we have to keep in mind, and I'm really grateful for regulators who drive these efforts, because it helps secure a safe supply chain, and ultimately the patient is the one to benefit from that most. If I summarize on the use of GS1 identifiers in hospital, and I just summarized a few items because I didn't want to make more than one slide on this. If I look specifically on the supply chain side, if identifiers are already placed on the products because regulators drive this and the manufacturers have to comply with the regulation, why then not make use of it as a hospital? That's a very simple explanation, but that's what got me hooked years ago to the GS1 system, and that's why I now have joined the GS1 organization. What it also does on the supply chain side, it really helps efficiency. If stock is managed this way, stock items can be reduced, assortments can be rationalized. It supports just-in-time delivery. It really supports also focusing on not using beyond expiry dates. So that again reduces a lot of waste. It supports professionalizing the procurement of hospital supplies, because if your warehouse management system is linked automatically to your procurement system, whatever is used in theater will be shown directly in your procurement system, and you can do direct ordering, so it is very, very efficient. It helps track and trace all medical supplies, not only in your hospital, but if there is a recall from external, you can easily link into the recall information and do the recall in your hospital. If I look at the patient side, it is a great, great support to facilitate the point of care scanning. So whatever medication a patient gets can be scanned, uploaded in the patient record directly, which adds other benefits. Devices used in theater can be linked directly, so it's really, really safe. It supports patient safety. What it also does, it supports safety of personnel, of medical staff, and it supports medical staff to focus on their primary tasks because they don't need to be so busy with logistics. And that also is, if medical staff is more at ease, that's a big support for patient safety. If there is a necessity in your country to upload to implant registries, scanning the device in theater will automatically help you facilitate uploading to the implant registries. And overall, yes, you need to invest, but investments on this will definitely be followed by return on investments. And we can share several examples on that. And what it does, and I hope that that is something that the COVID crisis made very clear, it supports the agility of your organization. And it supports your supply chain to be very agile and very sufficient. Coming to a close of this of my presentation, never before has a global crisis made so clear that a secure and efficient supply chain is needed to prevent patients from getting more harm and to prevent medical staff from being harmed, and also to help save cost. Just a few headlines before I give the floor back to Eric. Healthcare supply chain, whatever we think, is a global healthcare supply chain. We've also seen that during the COVID time, when countries closed their borders, trying to seal the PPEs in their own country didn't work, because the PPEs are, even if a company is originally from your country, they might manufacture a part of their materials in other countries. So the global supply chain, if the healthcare supply chain, is really global, and we need to make use of that. The GS1 standards support the healthcare supply chain, connecting the supplies to clinical outcomes and to patients. And this terrible COVID pandemic shows us that we really need to support our medical staff in the best possible way with optimized processes for a safe future and safe way of working. And then finally, because this is what GS1 does, let's improve patient safety. That's my driver to join GS1. Help all of you improve patient safety in all of your countries and your hospitals. And a simple scan can actually help support that. If you want to see more details, more clarifications on our healthcare website, you can find a lot of material. And I'm, of course, also more than happy to answer questions. And thank you very much for listening. And thanks, Eric, for giving us the opportunity. Back to you.
Thank you so much, Els, for your presentation. That is really underscoring the importance of having this traceability system in place for the safety of the patients and the safety of the people. You mentioned at the end of your presentation, that we are part of a global system, and there is questions around that. How much, if you want to have a reliable system for supplying your hospital, you should rather rely on a system that is a national system versus an international one. And perhaps to add to this question, you mentioned the GTIN,
yes,
the global identifier. are we sure when we are relying to an international system that there are no fakes? You know, how can we make sure that, is that protecting us when we as healthcare providers in a situation of crisis have to rely to new suppliers that we are not familiar with? Is this a way for us to make sure if they have this kind of codes that at least they are well in an international system and they are somehow at least not a fake company? I would not say it guarantees the quality of the product, but at least it demonstrates that it's a company that is doing trading in a regular way and in the normal business environment.
Thank you very much. That is a very good and very, very important question. As I said, healthcare is money-making business. So people try to make money out of it always. And in that way, we cannot fully prevent illicit trade and fraud. But by using this GS1 standards, we can secure as much as possible that the products can be traced well. And just as an example, if you want to buy something from the internet, sometimes you click on, when you want to order, if you click on something, another picture pops up, another product. Then that one is not a safe supply chain. Medication that you order on internet as a private person, most of it is not safe but fake. And there are, there are big reports to explain that. McKinsey has written several reports. The WHO is warning for this system. And what we can ensure is that companies, global working companies that have the GS1 standards, the GTIN on their products, they are as safe as possible. And probably, I didn't want to go too much into that in the presentation, but in the past, there have always been cases where illicit companies have made very much look-alike products and bring them on the market. But by scanning and having regulation in place, these illicit products can be filtered out of the market very, very rapidly. I hope that answers the part of the safety on the use of the GS1 standard. The other question, the other part of your question was on shouldn't you have a national system? I understand, because I've heard a lot of news also during this COVID crisis, I understand that a lot of people say to be globally dependent on partners doesn't help us enough. We really need to make our own products, have everything from next door, etc. That would be in favor of a national system. However, the world is like a global village, and the world will remain a global village. And once the big pressure of the pandemic is a little bit eased, is a little bit less on all of us, we will see the major economic effects. And there are a lot of countries that are not able economically, qua knowledge, etc., to set up complete local supply chains. And I don't think it would be wise. We can make so much use of what is internationally and globally available. If we work on a safe global system, that will help us most. And if you look, for instance, at Europe, in Europe, 28 countries, because the UK was still part of this initiative and still is at the moment, there has been a medication safety system, falsified medicine directive in place, which is the same, has the same foundation for all 28 countries. For medical devices, there is a similar system that was to become operational mid of this year, and due to the COVID crisis, the European Commission has postponed the start until next year. But it's the same system that will be in place for all the 28 countries in Europe. And that facilitates also sharing, etc., etc. So I understand why people say, shouldn't we have everything next doors? But I think the bigger benefit, and eventually also the cost benefit and quality benefit, will be on making proper use of a global system. Does that answer the question, Eric?
I believe so. It's a very comprehensive answer. There is a question about, who is owning legally the barcode? Is that GS1 who is, because you are generating the system behind it? Or is it the one that is using the system and creates his own identifier that is after translated into a visual, which can be the barcode, or it can be electronic devices that can be the identifiers?
Very, very good question. Thank you for asking. GS1 doesn't own the barcodes. GS1 is sort of, how do you call that in English? That's a difficult word. GS1 feels responsible for the barcode. And what we do is, for instance, for healthcare, GS1 is being named one of the issuing agencies. It's a bit technical, but let me explain to make clear what we are talking about. GS1 is issuing agency, for instance, in the US. The FDA selects issuing agencies, and that are agencies that are allowed to share barcodes with manufacturers. So it's the manufacturer, in fact, who comes to GS1 and says to us, I want to make use of your barcode on my products, because otherwise, I cannot sell my products in the US, for instance, make it very, very simple. And then the manufacturer puts the barcode on the product. What the FDA then asks of GS1, the FDA says to GS1, you're issuing agency, people can come to you to get the barcodes, but you are also the one responsible to check if the manufacturer is making proper use of the barcode or not. So then that's kind of a quality check on the use of the barcode. That's what GS1 is doing. So we protect the product. We don't own the product. And if a new barcode should be developed, we developed last year a specific barcode for clinical trials, which, for instance, is very, very helpful for clinical trials that are starting specific for the COVID. We then have specialists from GS1 who understand the barcode technology, but they are only supporting because the people that form the group to talk about the barcode, what should it do, what should be in, etc., is really the users. So we had people from manufacturers, pharmaceutical manufacturers, because they do a lot of clinical trials. And we had oncologists, people working at oncology hospitals, because they are also involved in these clinical trials. And together they then discuss. And when they have something that we think could be a proper system, that is being taken to the GS1 internal policy makers. I say internal, but it's not only internal. There also the users are part of the decision-making process. And then we do not have so many healthcare users. It's users from other sectors who say, hey, does this really fit the standards? And so that's then the way how a new standard is developed. So that's really with the users and for the users.
Okay, that's very interesting, because it demonstrates really that it is a co-production.
Yep.
By all the stakeholders that are involved in the whole chain, yes, between those who are eventually producing the goods, to those who are handling them, and to those who are using them at the end of the day. and those who have the place or the facility where the goods are used.
Yep. Yep.
You mentioned several times, you know, that of course putting in place a system like that in a healthcare facility requires some investments, and as you could guess, we have questions about, you know, how much dollars or how much euros, how much pounds or whatever should I put on the table? I guess it's not an easy question because that depends, of course, of the size of the facility and the complexity of the traceability you want to put in place. But can you give some examples of, you know, kind of a minimum system for a general hospital to a sophisticated system doing track and trace broadly in a more complex large hospital?
Yeah, very good question. And I understand that people want to know. Looking at the investments, we have some examples of hospitals that we have one example of a hospital in the Netherlands that did a major implementation in their operating room on the medical devices some years ago, and they had a return on investment within 6 to 9 months. If you want to do an implementation for an entire hospital, you know, that's very, very ambitious. You need to make a plan, you need to do a step-by-step approach. And since you save a lot of manual procedures, you can save a lot on correcting procedures, on internal auditing procedures will be much more efficient and lean. It does save costs. It's very complicated to, you know, to fit some dollars to this implementation. And what is very important also is what is the situation in your hospital? Are you already using IT, yes or no? If you have, and you can reduce costs. That's what I did when I worked in a hospital. You can reduce costs if you are clever at combining implementations. For instance, if you are at the process of starting an electronic patient record, then already you can discuss with the suppliers, the solution providers for the electronic patient record, how your processes should look like, and at which point in time you would need to have the identifiers being scanned. And when you train your staff for the electronic patient record use, you can help them also to understand about the barcode scanning, and then you only have your investment of training the staff once. So it's a matter of clever planning. And also, if you have to be we all have to be conscious about finances. You can start with one project on a department where you think you'll have quick win. For instance, your stock keeping, the return on investment on that being used for your second project, etc. I hope that helps.
Yeah, and I guess, yeah, I mean, when you have quite complex solutions, you cannot have a very easy, straightforward answer. And I really think that the approach that you put forward, saying that this is can be a step-by-step approach, is a very important one, because it means that you don't need to have, you know, a threshold of investment.
No.
To start and to have a comprehensive system all at once. You can really build it up and starting for where you have most interest in return on investment.
Yeah, and maybe Eric, one thing to add on that, at GS1 we really try to support our members and our users. So we also have started a few years ago a specific working group with the solution providers. So the big companies that work on electronic patient records, also you need a barcode scanner. So, you know, all of these several steps in the solution provider side, we link to these people and we share with them information, help them to understand what is needed for the end users, so that we can help facilitate connecting and reducing costs in the final, you know, that's one of our goals also, increase patient safety and reduce costs.
Just perhaps a last question before closing, because I don't see any other from the audience on safety, which is a very important issue, of course, for all of us, for the staff and for the patient. Would you, do you have a plan to look at the hospitals that have quite a comprehensive system of GS1 tracking and tracing in place to see if in the period of strain that they have faced with the COVID, where the staff was overwhelmed by activities, had to work extra hours, had to work on processes that were kind of new often, if they, the one that have been supported by a system like that, if it's recorded that there is potentially less errors, because we all know that errors are coming when people are tired, when processes are not well mastered, and the fact that it is automatized, it removes all this strain on the staff, in addition to the one that they have to face with taking care of the patients. So would you explore a little bit that, because I really think that that's an important lesson we need to build on for the future.
Yeah, very good question. Is something that is in the back of my mind, because right now we cannot ask any hospital anything extra. People are still working overtime and they need to recover a bit. I've been in contact with some of the hospitals that our member organizations work with, and I have learned from them that they had the system in place quite well, the GS1 system, and that really helped them very, very well, up to the moment when supplies came in that were not barcoded correctly. And then it was very, very difficult for them to track and trace their materials and to give comfort to their staff as they would like to do. So we will definitely at GS1, also with our healthcare leadership team, look into what can we ask from our stakeholders to learn from this, and how to better help them get prepared for a next. I don't hope we'll have a next one, but anyway, to be better prepared for the future. So we'll definitely come back to that. But at the moment, we can't ask too much from people. Everybody is still working a lot of overtime. And I am not sure, Eric, if people will be able to trace back exactly if something didn't work well, if it was due to, at the patient side, if it was due to the GS1 system or not. Then you would need to do really monitoring on the dot. And we are working on a system that on a tool that will help the hospitals to do the monitoring, but that needs to still be put in place. So yes, we want to take our learnings out of this and see how we can best support all stakeholders in healthcare so that all patients will benefit.
Okay, thank you. Just a last question that came in, and I'll push it before I wrap up, is a question about COVID contact tracing, which we all know is a very important public health challenge. Is GS1 more or less involved in that, and all the discussions about the COVID contact tracing?
Now, good question again. You got many, many good questions. Now, GS1 system is mainly for the supply chain and for product identification. You can use the GSRN, the GS1 standard for patients and staff, but these should be used only inside one facility or inside one organization. And privacy is very, very important. And we are really working on the safe supply chain. So in the safe supply chain within a hospital or a healthcare facility, it's necessary to be able to trace patients and staff, but we are not involved in making an app, for the rest of the world.
Okay, thank you very much for this last response to the questions. And I think we had a very interesting sessions covering a number of topics. As you know, we all are facing the COVID crisis. We are also getting ready for what's called the next normal. I mean, because life goes on. And I want to draw a few messages as a conclusion in regard to this perspective, for which I really think that the next normal will be about resilience more than ever. And from that, it is clear that a systematic identifier, according to regulation, is a very important element to have safe products on your supply chain. And safe products in a supply chain, that's part of the resilience you need in a system. The other element is that having systematic identifier system might be an important investment, but definitely there is here also a significant return on investment. We cannot do it during a crisis, but you know, like any investment, it cannot be postponed if you want to have the results. So after the crisis, I think it will be really time to work on it, because that's what will bring the overall efficiency within the organization, with tracking and tracing all the processes, the products, and the people. The other one is around the staffing, because we talked a lot about how the staff has suffered with this crisis, and we all have acknowledged that and paid tribute to their contribution. But as much as we can take out transactional activities, bureaucratic activities that are so necessary to track and trace out manually into a systematic 100% reliable system, this will be also another way to make sure that we bring safety without putting also the staff at risk of personal liability. And that's something that we have to think when we talk about having identifiers and tracking and traceability system. And last but not least, and it was part of the question, is that behind that you generate a whole lot of data, of information related to the flow, to how the processes, and certainly after a crisis, it will be a great source of information to understand where you had gaps and how you can improve for the next time you have to face another type of crisis, or anyhow to improve your productivity, your efficiency, and your safety. Any other last thoughts before we are closing the session, else? And after, I'll give the floor back to Patricia.
Well, just one. A lot of people, and thank you very much for summarizing. I think you summarized very neatly. Some people said to me, during this crisis, healthcare is so much on the forefront of this, they will receive a lot of extra money afterwards. Yes, that would be great, because we always need more money in healthcare. But the other side of this crisis is that there'll be a lot of economic loss, and countries will face a lot of difficulties. So healthcare will need to work on being more efficient, more lean, in order to cope, with the economic side effects of this crisis. And yes, I fully agree that I look forward to the end of this pandemic, to be honest, but I also look forward to get some ease in this pandemic for healthcare professionals and hospitals, so that we can actually help them generate their questions on this specific topic and how we can help them in the future. And I know we have our member organizations work very, very hard in many of the countries on healthcare issues, and they'll be more than happy to answer any questions that specific hospitals might have. So thank you very much, Eric, and IHF for giving us the opportunity to share this message. And any questions, more than happy to support. Thank you. And good luck to all, managing up to the end of this pandemic.
Thank you so much, Els, for your comprehensive presentation. And Eric, thank you for moderating the session. Again, to everyone, the recording of this webinar will be available on the IHF website, and we will inform you via email once it's uploaded. We hope you can join us again. We still have several webinars signed up in the next few weeks. The schedule is now on your screen, and you can register by going to our website, www.ihf-fih.org/webinars. We hope you can join us on Tuesday, where Professor Americo Cicchetti will talk about the different organizational models of response used around Italy, the role of COVID hospitals in the Italian regions, and best practices on managing COVID-19 between hospitals and other healthcare settings. We hope to see you there. In the meantime, please stay safe and healthy, and together we will overcome this crisis. Thank you again for joining us. Al, thank you so much for the presentation. Eric, thank you so much for your time. Goodbye, everyone.
Welcome. Thank you. Bye.
Thank you. Goodbye, everyone.